Right now, at this very moment, your kidneys could be failing and you would have absolutely no idea. No pain, no obvious symptoms, no alarm bells, just two fist-sized organs in your lower back silently deteriorating, losing function day by day, week by week, month by month, while you go about your life completely unaware that a catastrophe is building inside your body. Kidney disease is called the silent killer for a devastating reason. You can lose up to 75% of your total kidney function before you experience a single noticeable symptom. 75%. That means 3/4 of your kidneys can be destroyed before your body gives you any obvious warning sign. And by the time most people are diagnosed with chronic kidney disease, the damage is already extensive and much of it is permanent, irreversible, gone. But here is the thing that frustrates me as a physician more than almost anything else in medicine. Kidney disease does give you warning signs. It absolutely does. They are subtle. They are easy to dismiss. They are easy to attribute to aging, to stress, to a bad night's sleep, to getting older. But if you know what to look for, if you understand the early signals that your kidneys are sending you, you can catch the problem early enough to intervene, to slow the progression, to protect whatever kidney function remains, and potentially to avoid dialysis and transplant altogether. Today, I am going to reveal 5 early warning signs that your kidneys are in trouble. 5 signs that the vast majority of people, and even many doctors, completely ignore or misattribute. These are the red flags that your kidneys wave at you months or even years before the devastating late-stage symptoms appear. Pay attention to every single one. Warning sign number 1. Changes in your urine that you dismiss as normal. Your urine is a direct window into the health of your kidneys. Every time you use the bathroom, your kidneys are sending you a message about how well they are functioning, and most people never bother to look. The first change to watch for is foamy or bubbly urine. If your urine consistently looks like someone poured beer into the toilet, with a persistent frothy layer of bubbles on top that does not dissipate quickly, this is a significant warning sign. That foam is caused by protein leaking through your kidney filters into your urine, a condition called proteinuria. Healthy kidneys keep protein in your blood where it belongs. When the tiny filtering units in your kidneys, the glomeruli, become damaged, they develop microscopic holes that allow protein molecules to escape into your urine. The protein creates a surface tension effect that produces persistent bubbles. Occasional transient foam from forceful urination or concentrated urine is normal, but consistent, persistent, thick foam that shows up regularly is a red flag that demands investigation. The second urinary change is color abnormalities. Healthy urine ranges from pale straw to amber yellow depending on hydration. If your urine is consistently very dark, almost tea-colored or cola-colored, this can indicate that your kidneys are having difficulty properly diluting your urine, or it could indicate the presence of blood, myoglobin, or other abnormal substances that your kidneys are struggling to process. On the opposite end, if your urine is consistently completely clear and colorless despite normal fluid intake, your kidneys may be losing their ability to concentrate urine, which is one of the earliest signs of declining kidney function. Your kidneys are supposed to be able to concentrate waste products into a smaller volume of urine. When they cannot do this effectively, you produce large volumes of very dilute urine. The third urinary change is increased frequency, especially at night. If you find yourself waking up 2, 3, 4, or more times during the night to urinate, a condition called nocturia, this is not just an inconvenience. It is often a sign that your kidneys are losing their ability to concentrate urine during the night. Healthy kidneys respond to nighttime hormonal signals by producing smaller volumes of more concentrated urine during sleep, allowing you to sleep through the night without needing to urinate. When kidney function declines, this concentrating ability diminishes, and you produce larger volumes of dilute urine around the clock, including during the hours when you are trying to sleep. Warning sign number 2. Persistent, unexplained fatigue that does not improve with rest. Everyone gets tired. Everyone has days when they feel drained and exhausted. But there is a specific type of fatigue that is associated with declining kidney function, and it has distinctive characteristics that set it apart from ordinary tiredness. Kidney-related fatigue is deep, pervasive, and relentless. It is not the kind of tiredness that a good night's sleep or a weekend of rest can fix. You wake up tired after 8 or 9 hours of sleep. You feel heavy and sluggish throughout the day. Your mental clarity is diminished. You have difficulty concentrating. Tasks that used to be easy feel overwhelming, and this exhaustion persists for weeks and months without improvement regardless of how much you rest. The mechanism behind this fatigue is twofold. First, your kidneys produce a hormone called erythropoietin, often abbreviated EPO, which signals your bone marrow to produce red blood cells. Red blood cells carry oxygen to every tissue and organ in your body. When your kidneys are damaged and their EPO production drops, your red blood cell count decreases. You develop anemia. And anemia means your muscles, your brain, and every organ in your body is receiving less oxygen than it needs. The result is a profound, crushing fatigue that no amount of sleep can resolve, because the problem is not sleep deprivation. The problem is oxygen deprivation at the cellular level. Second, when your kidneys cannot effectively filter waste products from your blood, those waste products accumulate. Urea, creatinine, and other metabolic toxins build up in your bloodstream, a condition called uremia. Even in its early, mild stages, uremia causes fatigue, mental fog, loss of appetite, nausea, and a general feeling of being unwell that patients often describe as feeling poisoned from the inside. And in a way, that is exactly what is happening. Your body is being slowly poisoned by its own metabolic waste because your kidneys can no longer remove it efficiently. Warning sign number 3. Swelling in your ankles, feet, hands, or face, especially in the morning. This is one of the most commonly ignored early signs of kidney disease because people attribute it to standing too long, eating too much salt, wearing tight shoes, or simply getting older. But persistent, unexplained swelling, medically called edema, is a direct signal that your kidneys are struggling to maintain proper fluid balance in your body. Your kidneys regulate the total amount of fluid in your body by adjusting how much water and sodium they retain versus how much they excrete in your urine. When kidney function declines, the kidneys lose their ability to efficiently excrete excess sodium and water. Fluid begins to accumulate in your tissues. Gravity pulls this excess fluid to the lowest points of your body, which is why you often notice swelling first in your feet, ankles, and lower legs. But if you notice puffiness around your eyes or swelling in your hands and fingers, especially first thing in the morning before gravity has had a chance to pull fluid downward, this is an even more concerning sign because it suggests that the fluid retention is significant and widespread. Pay particular attention to socks that leave deep, lasting indentations in your ankles and shins. Press your fingertip firmly into your shin bone for 5 seconds, then release. If the indentation remains visible for more than a few seconds, this is called pitting edema, and it is a clear indication of fluid retention that warrants medical evaluation, including kidney function testing. The protein loss through damaged kidneys that I mentioned earlier, proteinuria, also contributes to swelling through a different mechanism. Albumin is the most abundant protein in your blood, and one of its critical functions is to maintain oncotic pressure, the force that keeps fluid inside your blood vessels. When your kidneys leak albumin into your urine, your blood albumin levels drop. Without adequate oncotic pressure, fluid leaks out of your blood vessels into your surrounding tissues, causing generalized swelling that can be dramatic and debilitating. Warning sign number 4. Persistent itching that has no obvious dermatological cause. This is the warning sign that surprises almost everyone, and it is one that doctors frequently misdiagnose as a skin condition, an allergic reaction, or dry skin. But unexplained, persistent, often severe itching, medically called pruritus, is a well-documented symptom of declining kidney function that affects a significant percentage of chronic kidney disease patients, even in the relatively early stages of the disease. The itching of kidney disease has several mechanisms. First, as your kidneys lose their filtering ability, phosphorus levels in your blood begin to rise. Excess phosphorus deposits in your skin in the form of calcium phosphate crystals, which irritate nerve endings and cause intense itching. Second, the accumulation of other uremic toxins in your blood stimulates itch-sensing nerve fibers in your skin. Third, the systemic inflammation that accompanies kidney disease triggers immune responses in the skin that produce itching. And fourth, the imbalance of parathyroid hormone, which rises dramatically as kidney function declines and phosphorus accumulates, independently contributes to skin itching. Kidney-related itching has distinctive characteristics. It tends to be widespread, affecting large areas of the body rather than localized spots. It is often worse at night, disrupting sleep. It may not respond to typical itch treatments like antihistamines, moisturizers, or topical steroids. It may come and go, but generally worsens over time as kidney function continues to decline. And it is often accompanied by dry, rough, or discolored skin. If you have persistent itching that your dermatologist cannot explain, that does not respond to standard treatments, and that has been present for weeks or months, please ask your doctor to check your kidney function, your phosphorus levels, and your parathyroid hormone level. This one request could uncover kidney disease that might otherwise go undetected for years. Warning sign number 5, a persistent metallic or ammonia taste in your mouth and changes in food preferences. This is another warning sign that most people completely overlook or attribute to dental issues, medication side effects, or aging. But a persistent metallic, bitter, or ammonia-like taste in your mouth, medically called dysgeusia, is a classic early symptom of kidney dysfunction. As your kidneys lose their ability to filter waste products from your blood, urea and other nitrogen-containing compounds accumulate in your bloodstream. These compounds are partially excreted through your saliva and your breath. When urea breaks down in your mouth, it converts to ammonia, which produces that distinctive metallic or ammonia-like taste. Some patients describe it as tasting like pennies or as a persistent bitterness that will not go away regardless of how much they brush their teeth or use mouthwash. This taste disturbance often leads to changes in food preferences that patients do not connect to kidney problems. Foods you used to enjoy taste different. Meat tastes metallic or repulsive. Sweets taste excessively sweet or strangely bitter. Your appetite decreases overall. You find yourself gravitating toward bland foods or avoiding foods entirely because everything tastes wrong. Many patients experience significant unintentional weight loss during this period because eating becomes unpleasant rather than enjoyable. And there is another oral symptom that accompanies kidney dysfunction: bad breath that persists despite good dental hygiene. The ammonia being excreted through your breath gives it a distinctive urine-like or fishy odor that no amount of brushing, flossing, or mouthwash can eliminate because the source of the odor is internal, coming from your bloodstream, not from your mouth. Now let me tell you who is at the highest risk for kidney disease and who absolutely needs to be proactive about monitoring their kidney function. If you have high blood pressure, you are at significant risk. High blood pressure is the second leading cause of kidney failure in the world. The elevated pressure damages the tiny blood vessels inside your kidneys over time, gradually destroying the filtering units. If you have diabetes, you are at the highest risk of all. Diabetes is the #1 cause of kidney failure worldwide. High blood sugar damages the blood vessels in your kidneys, causing diabetic nephropathy that progressively destroys kidney function. If you have a family history of kidney disease, your genetic risk is elevated. If you are over 60, your kidneys have naturally lost some function simply due to aging, and they are more vulnerable to additional insults. If you are obese, the excess weight places additional metabolic stress on your kidneys. If you take NSAIDs regularly, as I discussed in a previous video, you are putting your kidneys at risk with every dose. If you have a history of kidney stones, the underlying conditions that cause stones can also damage kidney tissue. If you smoke, the chemicals in tobacco directly damage kidney blood vessels and accelerate kidney function decline. Here is what I want you to do right now. First, pay attention to your body. Go through the 5 warning signs I just described and honestly assess whether you are experiencing any of them. Even one of them warrants further investigation. Second, ask your doctor for a simple kidney function screening. This involves 2 basic tests. A blood test measuring your serum creatinine level, from which your estimated glomerular filtration rate, or eGFR, is calculated, telling you what percentage of your kidney function remains. And a urine test checking for albumin, the protein that leaks through damaged kidney filters. These tests are inexpensive, widely available, and can detect kidney disease years before symptoms become obvious. Third, if you have any risk factors I mentioned, high blood pressure, diabetes, family history, age over 60, obesity, regular NSAID use, request kidney function testing at least once per year. Early detection is the single most important factor in slowing the progression of kidney disease and avoiding dialysis. Fourth, protect the kidney function you have. Stay adequately hydrated. Control your blood pressure. Manage your blood sugar if you are diabetic. Avoid NSAIDs and other nephrotoxic medications whenever possible. Limit your sodium intake. Do not smoke. Maintain a healthy weight. These basic measures can dramatically slow the progression of early kidney disease and preserve your remaining kidney function for decades. Your kidneys filter approximately 50 gallons of blood every single day. They produce hormones that regulate blood pressure, stimulate red blood cell production, and activate vitamin D. They maintain the precise chemical balance of electrolytes that your heart, muscles, and brain depend on to function. They remove toxins, drugs, and metabolic waste from your blood. They regulate the total fluid volume in your body. They are performing miracles for you every second of every day, silently, without recognition, without gratitude, without complaint. But they cannot cry out for help. They cannot send you a sharp pain when they are struggling. They suffer in silence until they reach a point of critical failure. The only way they can communicate with you is through the subtle warning signs I just described. Now you know what those signs are. Now you know what to watch for. Now you know when to act. Do not ignore the whispers of your kidneys, because by the time they scream, it may be too late to save them. Let me also share a critical piece of information that ties everything together. The 5 warning signs I described do not exist in isolation. They are interconnected, and experiencing multiple signs simultaneously significantly increases the likelihood that kidney disease is the underlying cause. For example, foamy urine combined with ankle swelling is a particularly concerning combination because it suggests that your kidneys are both leaking protein and failing to regulate fluid properly. 2 different aspects of kidney function deteriorating simultaneously. Fatigue combined with itching suggests that your kidneys have declined enough to cause both anemia from reduced erythropoietin production and phosphorus accumulation from impaired filtration. These are not independent symptoms that happen to coexist. They are different manifestations of the same underlying organ failure. If you recognize 2 or more of these signs in yourself, the urgency of seeking medical evaluation increases dramatically. Do not wait for your next scheduled checkup. Call your doctor this week. Explain what you are experiencing. Use the specific medical terms I have taught you today: proteinuria, nocturia, uremic symptoms. These words will communicate to your medical team that you are informed and that your concerns should be taken seriously. And here is one more thing that I think is absolutely vital for you to know. Kidney disease disproportionately affects people who already have other chronic conditions, and those conditions are incredibly common. If you have high blood pressure, your risk of kidney disease is dramatically elevated because the constant high pressure damages the kidney's delicate filtering structures year after year. If you have diabetes, your risk is even higher because elevated blood sugar directly poisons the cells in your kidney filters. If you have both high blood pressure and diabetes, which millions of people do, your kidneys are being attacked from 2 directions simultaneously, and your risk of eventual kidney failure is substantial. The tragedy is that in most of these patients, aggressive management of blood pressure and blood sugar could have preserved kidney function for decades. But because kidney disease is silent, because it does not announce itself with dramatic symptoms, the opportunity for early intervention is missed over and over and over again. By the time the kidneys finally cry out loudly enough to be heard, through the symptoms of advanced kidney failure, it is often too late for anything other than dialysis or transplant. This is why I am so passionate about getting this information out to you. Early detection is everything. A simple blood test and a simple urine test, performed annually for anyone with risk factors, can catch kidney disease at a stage where intervention is effective and meaningful. It costs almost nothing, it takes almost no time, and it could save you from a lifetime of dialysis 3 times per week, 4 hours per session, for the rest of your life. That is the alternative. That is what happens when kidney disease is caught too late. Do not let that be your story. Type in the comments which of these 5 warning signs you have noticed in yourself. Be honest. And type "get tested" if you are going to ask your doctor for a kidney function screening at your next appointment. Share this video with everyone you care about. Kidney disease is preventable if caught early. It is manageable if detected in time, but it is devastating if ignored until it is too late. You could save someone's kidneys and someone's life by sharing this video today. Subscribe and turn on notifications. Your kidneys are counting on you to stay informed. I will see you in the next video. Listen to your body. It is talking to you. Are you listening?